Stakeholders in the nation's health sector have called for concerted efforts to address the challenge posed by NOMA disease in the country. They made the call at an event to mark this year's National Day of NOMA. Neil Sampson reports.
It is an infectious but not contagious bacterial disease that starts as an inflammation of the gums, similar to a small mouth ulcer. The infection destroys the bone and tissue very quickly, affecting the jaws, lip, cheeks, nose or eyes, depending on where the infection started. The disease affects young children's tissue whose resistance are undermined severely. A 2019 study estimated that from 2010 to 2018, the prevalence rate of NOMA in Nigeria was 1.6 per 100,000 population. Hence, the need for the federal government to intensify efforts to address the disease.
It's usually done by very impoverished, it usually affects impoverished children because of malnutrition and bad health care. And then by the time it happens, usually this happens in very rural settings. Attention has not been paid much to the children that are afflicted by this disease. So you discover that a number of children, into hundreds, are afflicted, but the attention of either the governments of our countries and also healthcare generally is not focused on them.
This year alone, we have seen more than 300 patients with NOMA, including the active and follow-up cases. But for the active cases alone, we have seen more than 140 active cases this year alone, and we are now in November.
To address the challenge, the federal government has reaffirmed its willingness to find lasting solutions to NOMA.
The federal government, in collaboration with partners, is working assiduously to eliminate the scourge of NOMA and to restore dignity to the victims in Nigeria. The Federal Ministry of Health has established National NOMA Control Program and Technical Working Group aimed at prevention and control of the disease.
The National Orientation Agency has been part of it, facilitating the training of our community orientation and mobilization officers, who in turn, after the training, go into the communities, liaising with the leaders, opinion molders, and gatekeepers, including the traditional healers. You know, we have people who will tell you that this disease is from witchcraft.
It is important to mention that Nigeria, in collaboration with other African countries as well as partners, requested the World Health Organization to include NOMA into the neglected tropical diseases list. This move will further spotlight NOMA so as to receive the required attention it deserves.
Experts say prevention of NOMA disease lies in food security, measles vaccination, prevention of malaria and HIV, including early detection. Neil Sampson, Trust TV News, Abuja.